There's more to do about migraine than just taking medication. There are certain foods to avoid. There are certain nutrients that are very impressive in the management of migraine. Migraine has to do with abnormal vasodilation and vasoconstriction of blood vessels. It has to do with the amount of serotonin released from platelets. It has to do with platelets clumping together. So it's multifactorial, and there are many foods that you should be avoiding. There are many foods you should be eating. There are certain exercises of your neck that you should be doing. So my general point of view about migraines is medically managed is incomplete, because all they're going to do is put you on a medication. Did the doctor talk to you about what foods to avoid? Yeah, exactly. I mean, that's exactly what I'm talking about. Every patient with migraine should be given a sheet. Even if the doctor doesn't know anything, they can print it up and hand you a sheet. Don't eat aged cheeses. Don't eat chocolate. Don't eat certain nuts. Don't eat, herring. I mean, lots of different things on that list you shouldn't be eating, but they don't even tell you this. So there are lots of different ways to manage migraines. That medication's fine. You might do well on it. You might not. But no matter what you do with these medications, all you're doing really is covering up the symptoms. You're going to feel better, but the underlying problem is always still there. There's not one medication that gets rid of the underlying issue in migraines. They're all designed to make you have less headaches. And you can do that with nutrients as well, by the way. So what I always say is, with these neurological issues like migraines, medical treatment alone is incomplete. It's the same thing I say with medical treatment of Parkinson's, medical treatments of irritable bowel syndrome. Pretty much medical treatment of everything is essential in a lot of cases, but always incomplete. And you should be working with a team, a clinical nutritionist, a chiropractor, an acupuncturist, a psychologist, whatever that team should consist of, and you all work together for the main purpose of getting you into great chemistry. So the medication itself is okay, but is there more to it than that? Absolutely.